Okay, guys, so now we're going to talk about the vascular system. Your vascular system is actually about 60,000 miles long. That's long enough to go around the Earth 2 times. That's kind of amazing when you think about it. Every part of your body relies on the vascular system. It's got to be able to get to every part of your body, and it's got to be able to adapt to changes along the way. There are really 3 types of blood vessels. The arteries, those are the ones that carry the blood away from your heart, like your aorta, we just learned about that. And the veins, those are the ones that return blood to your heart, like the superior and inferior vena cava. The capillaries, they are the ones that connect the smallest arteries to the smallest veins. Blood vessels have 3 layers. The inside layer is called the tunica intima. It's a layer of simple squamous epithelium. It's continuous. It's the same endothelium. It's the same as the endothelium that lines your heart. That's what I was trying to say. It's got to be a smooth surface. It's what keeps blood flowing freely. If it's not smooth and blood gets caught up on it, the blood cells get stuck, and then you get a blood clot inside your vein, and that's not what you want. This layer also produces chemicals that can cause the blood vessels to dilate or constrict. The tunica media, that's this part here. That's the middle layer. That's composed of smooth muscle tissue and elastic tissue, and that's what allows the blood vessel to change its diameter. The smooth muscle in this layer is, trying to think of another word for innervated. It's got running throughout it nerves that come from the autonomic nervous system. And then the tunica externa, that's the outer layer. That's this layer here, also right here. It's strong, flexible, fibrous connective tissue. This layer supports and protects the blood vessels. In veins, this is the thickest of the 3 layers. In arteries, it's usually a little thinner, and in arteries, the middle layer is the thicker layer. There's different categories of arteries. There's conducting arteries, also known as elastic. They expand as the blood surges into them and recoil when the ventricles relax. They're the body's largest arteries, and they include like the aorta and the common carotid. The distributing arteries carry blood to specific organs and areas of the body. They include ones like the brachial, the femoral, the renal arteries. And then arterioles are the smallest arteries. Through contraction of smooth muscle in their walls, they can resist the flow of blood, which helps to regulate blood pressure and control blood flow into an organ. Veins, the further away from the heart they are, the smaller they are, so as they go back towards the heart, they get bigger. Their walls are thinner than arteries because there's not as much pressure on them as the arteries have. Veins can stretch. They can carry varying amounts of blood with almost no change in pressure, and because of that, they're called capacitance vessels. I have trouble with that word too. Veins can also constrict extensively, which helps your body maintain blood pressure when blood volume drops. There's, of course, categories of veins. The venules are the smallest ones. They're the ones that collect the blood from the capillaries. They have thin porous walls, and they can exchange fluid with surrounding tissues. The medium-sized veins result from the convergence of the venules. They have thicker, more elastic walls, and these are the ones that have the one-way valves to prevent backflow. Same as the valves in your heart prevent backflow from one chamber to another, the valves in your veins prevent backflow and hopefully keeping the blood flowing one direction. The large veins result from the medium-sized veins coming together. These walls have a thick tunica externa, so the very outer layer is thick. These are those large veins, the vena cava and the pulmonary veins. And then the capillaries, these are the tiniest ones. They're microscopic. They link the arterioles, the very smallest arteries, to the venules, the very smallest veins. They're called exchange vessels because this is where the nutrients and all the waste and hormones are transferred between blood and the tissues. Tissues with a high metabolic rate, like your liver, your kidneys, your heart muscle, they have a lot of capillaries. Connective tissues like your tendons, they have a lower metabolic rate, so they don't have quite so many capillaries. And some tissues, like the epidermis, cartilage, and the lens and cornea of your eye don't have any capillaries, and I know we've already learned that. The capillary walls consist only of an endothelium and a basement membrane. They have very small diameters. They're barely wide enough for blood cells to pass through. Capillaries are organized in what we call capillary beds. They're kind of like a network. That's what this is right here. And there's the arterial end and the venous end of the capillary bed. At the beginning of each network or each bed is something called a precapillary sphincter. Right here is one. Here's another one. There's another one here. During exercise, when your muscles are asking for more oxygen because they're doing more work, these sphincters will open, and then blood fills that capillary network so the exchange of oxygen and nutrients can happen. During rest, these sphincters close so blood is not filling all these because you don't have enough blood volume to fill every single capillary bed in your body at all times. Some organs like your liver, your bone marrow, and your spleen, they have a capillary that's known as a sinusoid. These are irregular blood-filled spaces. We learned about these when we talked about the liver and the digestive system. They're more permeable. They allow for passage of large substances like proteins and blood cells. That's how blood cells that are formed in the bone marrow enter the circulation. The walls of the capillaries allow for a two-way exchange, and they use those remember way back at the beginning of the class we learned about diffusion, filtration, and osmosis. Well, those are the things that are happening in the capillaries. They release chemicals like oxygen, glucose, hormones, and nutrients into the surrounding tissues, and then they take up waste like carbon dioxide and ammonia. They can also take up glucose, calcium, antibodies, and hormones and move them to other parts of the body. And then water also is moving in and out of the capillaries at a constant rate. Diffusion, that's probably the most important mechanism of capillary exchange. Substances move from greater concentration to lesser concentration. So you can see in this picture, blood is flowing into the capillary from the arterial end right here. It's carrying a pretty good supply of oxygen. So the concentration of oxygen inside the capillaries is higher than that in the tissues surrounding it. So here the blood inside has a higher concentration of oxygen than it is out here. So the oxygen is going to diffuse across the membrane into the surrounding fluid. At the same time, the CO2 that's higher concentration out here is going to diffuse into the blood where it's a lower concentration. It sounds simple enough, and it's amazing that this happens in your body constantly all the time. Filtration occurs closer to the arterial side of the capillary bed. Remember, arterioles have a higher pressure than venules. Arteries have a higher pressure than veins. So as the blood enters the capillary bed, it's at a little bit higher pressure than it's going to be when it leaves. You don't need to know the exact numbers. But this higher pressure is what helps to push plasma. The higher pressure in the capillary pushes plasma and dissolved nutrients like glucose and amino acids through the capillary wall and into the surrounding fluid. This is filtration. Because remember, we learned filtration works based on pressure more than concentration of solutes. Colloid osmotic pressure refers to fluid, actually water. As you can see on the left-hand side, the blood continues to move towards the venous end of the capillary where blood pressure inside the capillary drops. So here we're on the arterial end, pressure's kind of high. As we work our way through, now it's pretty low. This drop in pressure allows proteins in the blood like albumin to exert what we call the colloid osmotic pressure, in which the albumin pulls fluid along with the cell's waste products into the capillaries. I remember this because I remember learning that albumin is a volume expander. So the albumin that's in your blood, when the pressure goes down, it's going to be able to pull fluid from the tissues back into the blood to help keep your blood pressure up. Pulmonary circulation, that's the route that takes blood to and from the lungs to exchange carbon dioxide and oxygen. It doesn't supply the lung tissue itself with oxygen. That happens through the systemic circulation. But as we learned, blood leaves the right ventricle through the pulmonary arteries, which branch into the right and left pulmonary arteries. These pulmonary arteries enter the lungs. Then the pulmonary artery branches into lobar arteries, one for each lobe of the lung. Remember, and you're going to learn next week when we learn about the respiratory system. One lung has three lobes, one lung has two. And then those arteries branch into smaller and smaller arteries until they end at the capillary beds. These capillary beds surround the alveoli, and that's where oxygen and carbon dioxide are exchanged. Then the capillaries form into venules, which merge to form veins, which go together and eventually form the pulmonary vein, which takes the oxygenated blood back to the left atrium. Okay, so the systemic circulation, the circulation that goes throughout your whole body system, and supplies the oxygen and nutrients to the organs and remove the waste from the organs. All of the arteries arise directly or indirectly from the aorta. And the aorta originates in the left ventricle, and it's divided into three regions. The ascending aorta right here is the part that comes directly off the left ventricle. It says a few centimeters above the left ventricle. The right and left coronary arteries branch off of that to supply blood to the heart muscle or the myocardium. Then the aortic arch makes the arch that curves over the heart and turns downward behind the heart, making an upside down U shape. The aortic arch branches into three major arteries: the brachiocephalic artery, which supplies blood to the head and the right arm, the left common carotid artery, which extends into the neck, and the left subclavian artery, which supplies blood to the left shoulder and the upper arm. The descending aorta travels downward dorsal, so behind the heart, through the thoracic and abdominal cavities. It's called the thoracic aorta above the diaphragm and the abdominal aorta below the diaphragm, which kind of goes along with the body regions that you learn, the thoracic region and the abdominal region. The abdominal aorta branches into the right and left common iliac arteries, which then supply blood to the lower pelvis and the legs. And there's also branches off the thoracic and the abdominal aorta. You can see some of them here that go to either the liver or the kidneys or other various parts of pulses. Each beat of the heart produces a surge of pressure. It can be felt at certain points where the artery comes kind of close to the body's surface, like the carotid artery in your neck. The brachial artery in the antecubital region of your arm, that's the brachial artery is what you're finding when you start to take a blood pressure, so you know the best spot to put your stethoscope. The radial artery right here, on the radial side of your arm, that's where you feel the radial pulse when you're taking somebody's pulse rate. The femoral artery is right at the iliofemoral joint right there. The popliteal artery is behind the knee, so you'll feel it in the back of the knee, and sometimes you use that to take a blood pressure if you have to do somebody's leg, if for some reason you can't use their arm. The posterior tibial artery is on the inside of your ankle, and then the dorsalis pedis artery is the one at the top of your foot. Those are all important to know as you do a head-to-toe assessment when you get into your med-surg clinical. You're going to want to be able to find the pedal artery, the pedal pulse, which is the dorsalis pedis artery right here. You're going to be checking the radial artery, and then you learned last week the point of maximum impulse to hear your heartbeat for an apical pulse. So the principal arteries, the ones that I really want you to know, of course, the aorta, that's this big one right here that goes up and down through the middle of your body. I want you to know the femoral artery, and then of course there is also a femoral vein. We'll get to that in a second. Femoral artery is where your femur is. Popliteal artery, your axillary subclavian artery, the brachial artery, the radial artery. You should know that the renal artery is the branch off the aorta that supplies the kidneys. The superior mesenteric artery and the inferior mesenteric artery take blood to regions of your abdomen. The two common iliac arteries right here, the final branch of the aorta. And I think that's it. As far as those. Arteries of the head and neck. Your brain requires a constant supply of oxygen, so there's two arteries that supply it with blood. There's the external carotid artery that supplies most of the external head structures, and the internal carotid artery that enters the cranial cavity supplies the orbits and about 80% of the cerebrum. The right common carotid artery arises from the brachiocephalic, and the left common carotid arises from the aortic arch. The vertebral arteries arise from the right and left subclavian arteries. Each of those extend up the neck through the cervical vertebrae, and they enter the cranium. Circle of Willis is it's a circle, just like the name says. It helps to supply blood to the actual brain. It's created by several different arteries coming together. I'm not going to expect you to know all of the names of those arteries. If you wind up going into neurological nursing, you may need to learn these. For our purposes here, I just want you to know that there is a circle of Willis in the brain that helps to supply blood to the inside of the brain. Principal veins. The vena cava is the body's main vein, and you already know from the heart that there's the superior and the inferior vena cava. Some veins drain directly into those. Others drain into a second vein, which then merges with another vein before draining into it. There are superficial veins residing along the body's surface, deep veins lying in deep, well-protected areas, usually along bones and their corresponding arteries. So like the axillary vein here would be very close to the axillary artery that we learned about. The radial vein, same thing, right next to the radial artery. There's the femoral vein, the popliteal vein. There is a renal vein, hepatic veins. Those are the ones I really want you to know and be able to tell me where they are or where they drain blood from. Veins of the head and neck. The internal jugular vein receives most of the blood from the brain and face. The external jugular vein receives blood from the scalp, the facial muscles, other superficial structures, and then drains into the subclavian vein. The vertebral brain drains the cervical vertebrae, the spinal cord, and some of the muscles of the neck. The big ones to know are the jugular veins, the external and the internal jugular veins. When we talk about jugular vein distension, it's the external jugular that you're going to see. And you may even see patients in clinical who have IVs that have been placed into those external or internal jugulars. Those are placed by a physician, not a nurse, just so you know. Hepatic portal circulation. This is really an interesting topic to talk about. Veins from the digestive organs and the spleen send their blood through the hepatic portal vein to the liver. This way the liver can remove excess glucose, like right after you eat, as well as some toxins and bacteria before the blood gets back to the heart. Blood from the capillaries of the spleen, the stomach, the pancreas, the gallbladder, and the intestines flows into the superior mesenteric vein and the splenic vein, which then converge to form the portal vein. Blood from the left and right gastric veins empty into the hepatic portal vein. The portal vein then channels blood into the liver. The blood then is distributed into many microscopic sinusoids. Remember, sinusoids are like little cavities that hold blood, the capillaries of the liver. And then the blood flows from the sinusoids into the hepatic vein, and from there into the inferior vena cava, where it goes back to the heart. But before it gets to the inferior vena cava, it goes through all that hepatic portal system to get it all cleaned out and get all the toxins and stuff out, so those toxins don't get to the heart. Blood flows because of differences in pressure between two structures. This is known as the pressure gradient. As blood moves away from the heart, the blood pressure declines. It kind of makes sense. The greater the difference in pressure between the 2 points, the greater the flow. As blood flows, it meets resistance, and the greater the resistance, the less the flow. So we talked about cardiac output and how that was calculated. So if your cardiac output goes up, then your blood pressure is going to go up. If your cardiac output goes down, then your blood pressure is going to go down. Same with blood volume. If there's less blood volume to pump, then the blood pressure is going to be lower. And if there's a higher volume to pump, the pressure is going to be higher. Resistance, if the opposition to the flow, the resistance to the flow, and it's really that results from the friction of the blood moving against the vessel walls. So the higher the resistance, the slower the flow, and the higher the pressure. The lower the resistance, the faster the flow, and the lower the pressure. It's hard to picture. I try to think of it as like if you think of a garden hose. If there's more water going through the garden hose, it's going to come out the other end at a higher pressure. if there's not as much water going through, then it's just going to trickle out the other end. And if you squeeze the garden hose so it's smaller and increase the resistance, less water is going to go through, but it's going to go through at a higher pressure. It's the best way I can think of to talk about that, to relate that. So the peripheral resistance we just talked about is the resistance to flow that results from friction of the blood against the walls of the vessel. The amount of friction depends on not only the vessel diameter, like we just talked about, squeezing that garden hose, but also the viscosity of the blood. Viscosity is usually stable, but if it goes up, so your blood gets thicker, then the flow of the blood is going to slow down. It's going to be harder for your blood to pump it. If you think of putting water through a garden hose as opposed to putting like pudding, I guess, or even frozen water through a garden hose, the viscosity is higher because the frozen water seems thicker, and it's going to have more trouble getting through. So vasoconstriction, if your body senses, if those baroreceptors say, hey, the blood pressure is a little low, let's constrict these blood vessels and get that pressure back up. That's what's going to happen. You're going to constrict them, make that garden hose smaller, so the blood pressure is going to go up. The amount of blood going through, though, into the tissues, the blood flow into the tissues is going to decrease. If you dilate those blood vessels, that decreases the resistance, so the blood pressure goes down and the blood flow into the tissues increases. The elastic property of healthy arteries is what allows them to expand with each beat of the heart and to absorb some of the force of ejected blood. When the heart is in diastole, and remember that's when the heart is relaxing in between beats, the arteries recoil, and that prevents the blood pressure from dropping to zero. This expansion and recoil helps to propel blood downstream towards the capillaries. It also helps smooth out surges of pressure that can occur with systole, that's the contraction of the heart, which protects those smaller arteries. So blood velocity, the blood flow is fastest in the aorta. It's the largest vessel. It's also the closest to the left ventricle. By the time the blood reaches the capillaries, it's slowed down quite a lot because the capillaries are quite a ways away from the ventricle. There's been friction along the way that has slowed it down. The smaller diameter of the arterioles and the capillaries has put up more resistance, and the number of vessels has become greater, so there's more of them for the same amount of fluid to go through. That gives the capillaries a greater total cross-sectional area. Blood flow through the capillaries is slower than in any other part of the vascular system. This slower rate allows the capillaries time to exchange all those nutrients and the waste and the gases with all the surrounding tissues. From the capillaries to the vena cava, then the velocity will rise again because the veins have larger diameters and they have a smaller cross-sectional area. We talked about this before, the neuroregulation of blood pressure. Increased blood pressure, those baroreceptors are going to sense that, going to send a signal. The parasympathetic impulses are going to send signals to vasodilate, which will decrease the blood pressure. And on the other end of that, if the blood pressure goes down, the sympathetic impulses are going to be kicked in, causing some vasoconstriction and increasing your blood pressure. So there's several hormones that can affect your blood pressure. There's quite a few that will raise your blood pressure, and then there's one that's going to cause it to fall. The renin-angiotensin 1, angiotensin 2 system, it's a whole mechanism. We learned about that with the kidneys and the urinary system that works to increase your blood pressure. Aldosterone, remember that's secreted by the adrenal medulla when your blood pressure falls. That stimulates your kidneys to reabsorb some sodium. Water follows sodium. Blood volume increases and thereby blood pressure increases. The antidiuretic hormone, ADH, is secreted by the posterior pituitary when the water content of body falls. ADH promotes vasoconstriction and water retention. It stimulates your kidneys to hold on to some water too. Epinephrine and norepinephrine, these are secreted by the adrenal medulla when the body is under stress. These hormones cause vasoconstriction. Epinephrine also increases the heart rate and the force of contraction of the heart. And we learned about those with the endocrine system not too long ago. Atrionatriuretic peptide is released by the atria of the heart when elevated blood pressure stretches the walls of the heart. ANP, for short, causes vasodilation. It also stimulates the kidneys to excrete sodium. Water follows sodium, so blood volume falls and blood pressure falls. So venous return, most of your veins have to fight the forces of gravity to get blood back to the heart. That's part of why you have the veins, the valves in your veins, to help prevent backflow and help get that blood back up to your heart. There's also two other key mechanisms in venous return to help return blood. It's called the skeletal muscle pump and the respiratory pump. The skeletal muscle pump works because the veins in the legs are surrounded by muscles. When the muscles contract, they massage the vessels, they push blood up towards the heart. The valves in the vein, as I just said, ensure the blood flows upward, not backwards. When the muscles relax, the blood flows backwards, but they stop at those valves. Blood puddles in the valve flaps that keeps the valves closed and prevents further backward flow. So that's one way. And then the last thing we're going to talk about is the respiratory pump. During inhalation, your chest expands, the diaphragm moves downward. We're going to learn that next week. This causes the pressure in the chest cavity to drop and the pressure of the abdominal cavity to rise. The rising abdominal pressure squeezes the inferior vena cava, which forces the blood upward toward the thorax. The lower pressure in the thorax helps draw the blood toward the heart. Valves on the veins and the legs make sure the blood doesn't flow backwards. So we've talked about the different blood vessels, the arteries, arterioles, venules, capillaries, veins, the differences between the two, the different layers that they have, some specific veins and arteries that you need to know, and then some principles of circulation and blood pressure regulation, some hormones that affect that, some other ways your body can control its own blood pressure. And then the last things we talked about were the venous return, the return of blood through the veins to the heart, through the skeletal muscle pump and the respiratory pump.